Warning for seniors. 9 common drugs linked to rapid memory loss. Did you know that more than 55 million people worldwide are currently living with dementia? While aging and genetics play a big role, things we can't change, there's something most people don't realize. Everyday medications might actually be making memory problems worse. It's not something we usually think about, but these common drugs could be impacting your brain in ways you never expected. In today's video, we're going to take a deep dive into the top 9 medications linked to memory loss and even dementia. Whether you're taking any of these yourself or caring for a loved one, this is information you absolutely need to know. And stick around till the end because we'll also share 3 brain-boosting foods that can help protect your memory and support long-term brain health. 1. First-generation antihistamines. When you're dealing with allergies, colds, or sleepless nights, it's tempting to grab over-the-counter meds for quick relief. But what if I told you that some of these seemingly harmless drugs could be messing with your brain, especially your memory? Take Benadryl, for example. Chances are you've used it for allergies or to help you sleep. It feels like a safe bet, right? Well, here's the catch. Medications like Benadryl block a key chemical in your brain called acetylcholine, which is essential for memory, learning, and overall cognitive function. The more often you take these meds, the more you're risking your brain's ability to work at its best. The scariest part? Long-term use could raise your chances of developing dementia, so while popping these meds might seem harmless, the long-term consequences could be much worse than you think. If you're taking them regularly or someone you love is, it's worth having a conversation with your doctor about safer alternatives, especially if memory or cognitive health is a concern. 2. Benzodiazepines. When it comes to managing anxiety, insomnia, or seizures, many doctors turn to medications like Valium, Ativan, and Xanax. These drugs can provide quick relief for those struggling with stress, sleeplessness, or seizure conditions. But here's the thing, while they may help in the short term, they come with serious long-term risks, especially for seniors. Studies have shown that these medications can harm memory, particularly short-term memory, and that's a big deal for anyone already worried about cognitive health. Using Valium, Ativan, or Xanax regularly can impair brain function over time and increase the risk of developing Alzheimer's or other forms of dementia. It's not just about occasional use, it's the continuous reliance on these meds that slowly eats away at memory and brain health. If you or someone you love is on these medications, it's essential to understand the risks. Talk to your doctor about safer alternatives. It might feel like you need these drugs to cope, but the potential long-term consequences could outweigh the relief they provide. Protecting your memory and cognitive health should be a priority, and there are often safer options to explore. 3. Proton pump inhibitors, PPIs. If you've ever dealt with acid reflux or ulcers, you've probably been prescribed medications like Prilosec or Nexium. These drugs can work wonders to reduce stomach acid and relieve discomfort. But here's something many people don't realize. Long-term use of these medications can seriously affect your brain health. The problem? They can interfere with the absorption of vitamin B12, a nutrient essential for brain function and cognitive health. Without enough B12, your brain can lose some of its sharpness, leading to memory issues and mental fog. Even more concerning, studies have shown that long-term use of proton pump inhibitors like Prilosec and Nexium is linked to a higher risk of developing dementia. This is especially worrying for older adults already facing cognitive decline. It's easy to think of these medications as harmless quick fixes, but the reality is they can slowly rob your body of the nutrients needed to keep your mind sharp. If you've been using them regularly, it might be time to talk to your doctor about alternatives that better protect your brain health. Your memory and cognitive function are too important to overlook, and the long-term effects of these drugs could be more damaging than the short-term relief they provide. 4. Antipsychotic medication. When it comes to treating serious mental health conditions like schizophrenia or bipolar disorder, medications like risperidone and olanzapine are often prescribed. These drugs can be lifesavers, helping to manage symptoms and offer relief to those facing these challenges. But here's the catch. While they provide immediate benefits, they can also have troubling side effects, especially when it comes to cognitive function. Over time, medications like these can slow mental function, making it harder to think clearly, process information, or remember things. This is particularly concerning for seniors or anyone already struggling with memory loss. And what's even more alarming is that for people with dementia, risperidone and olanzapine can increase the risk of death. This is a hard truth that many may not know when these medications are prescribed. It's a stark reminder that while they can be useful in certain cases, they should only be used when absolutely necessary and always under a doctor's close supervision. If you or someone you love is taking these medications, regular check-ins with a healthcare provider are crucial to monitor side effects and ensure that the benefits outweigh the risks. Your mind is precious, and it's vital to protect it, especially when managing complex conditions like schizophrenia or bipolar disorder. Talk to your doctor about the safest options and make sure your cognitive health doesn't get overlooked in the process. 5. Z. Drugs. Non-benzodiazepine sleep aids. Many people turn to sleep aids like Ambien or Lunesta when they struggle with insomnia or other sleep issues. These medications can seem like a quick fix, helping you fall asleep faster when you're tossing and turning. But here's the catch. While they help you sleep in the short term, they can actually disrupt your body's natural sleep cycles. And that's a problem, because sleep is crucial for memory consolidation. When we sleep, our brains do important work storing memories, processing information, and preparing for the next day. But if your sleep quality is compromised by medications like Ambien or Lunesta, your brain can't perform these vital tasks properly. This can make it harder to form new memories or retain what you've learned. Over time, lack of quality sleep can lead to cognitive decline, especially for seniors who may already be facing memory issues. What's more, these medications can create a cycle. While they help you fall asleep, they don't give you the deep, restorative sleep your brain needs. So even though you might feel rested, your brain could still be struggling. If you've been relying on sleep aids like Ambien or Lunesta, it might be time to explore other, more natural sleep solutions with your doctor. There are alternatives that won't disrupt your sleep cycles or harm your memory. Your brain deserves the best care, and that starts with giving it the quality sleep it needs to stay sharp and healthy. 6. Tricyclic antidepressants. When managing conditions like depression, anxiety, or chronic pain, many seniors are prescribed medications like amitriptyline or doxepin. While these drugs can provide much-needed relief, they come with a hidden risk, particularly for your memory. Amitriptyline and doxepin are known for their strong anticholinergic effects, which means they interfere with acetylcholine, a vital brain chemical for memory and learning. Here's the problem. Acetylcholine is key for helping your brain function smoothly, especially when it comes to recalling memories and staying sharp. When these medications disrupt that process, it can lead to confusion and memory issues, which can feel like a slow but noticeable decline in cognitive function. For many seniors, this manifests as forgetting things more often or struggling to concentrate. It's not just a minor inconvenience, it can make daily life more difficult and frustrating. The hard truth is that many people don't realize the connection between these medications and memory loss until they start noticing cognitive changes themselves. If you or someone you care about is taking medications like amitriptyline or doxepin, it's important to have an honest conversation with a healthcare provider. Your doctor can help you weigh the benefits of these medications against the risks to your memory and may suggest alternatives that are less likely to affect your cognitive health. Protecting your brain function is essential, and finding the right balance between managing your condition and preserving mental clarity is crucial. If memory loss is a concern, talk to your doctor. There are options and solutions to explore. 7. Bladder control medications. If you've ever dealt with the discomfort of an overactive bladder, you may have been prescribed medications like oxybutynin or tolterodine. These drugs are commonly used to manage frequent urges and accidents, and on the surface, they can seem like a lifesaver, offering more control over your day-to-day life. But while they help with bladder control, they come with a hidden danger for your brain health. Oxybutynin and tolterodine work by blocking acetylcholine, a key brain chemical essential for memory, learning, and overall cognitive function. This means that while these medications may offer relief for bladder issues, they're also interfering with the very chemicals your brain needs to stay sharp. Over time, this can lead to shrinking areas of the brain involved in memory and learning, making it harder to remember new information or stay mentally clear. This isn't just a mild side effect. It can have a lasting impact on cognitive health. So, while these medications may provide short-term relief, the long-term risks to your brain shouldn't be overlooked. If you or a loved one are regularly using oxybutynin or tolterodine, it's crucial to discuss the potential risks with a healthcare provider. There are alternatives available that may offer relief without the cognitive side effects. You deserve to feel good in your body without sacrificing mental clarity. Protecting your brain function is just as important as taking care of your bladder. Don't hesitate to talk to your doctor about safer options. After all, your brain deserves the best care. 8. Statins. Cholesterol-lowering drugs like atorvastatin and simvastatin are widely used to manage high cholesterol, and for many, they're key to protecting heart health and reducing the risk of heart attacks or strokes. But there's something important to be aware of if you or a loved one is taking these medications. While they lower cholesterol effectively, some research suggests they may also affect memory, particularly short-term memory. Not everyone experiences this, and the evidence is still mixed. However, if you've noticed your memory isn't as sharp while taking atorvastatin or simvastatin, it's worth discussing with your doctor. Memory issues can be subtle at first, so you might not connect the dots immediately, but over time, they can become more noticeable. Remember, your brain health matters just as much as your heart health. If you're dealing with memory lapses, confusion, or trouble concentrating on these medications, don't ignore it. Talk to your healthcare provider. There may be alternative medications or adjustments that can help manage your cholesterol without impacting your memory. You deserve a treatment plan that supports both your heart and your mental clarity. So if you're noticing any memory changes, take the time to speak with your doctor. It could lead to a better solution for you. 9. Barbiturates and strong painkillers. When managing pain or treating seizures, medications like phenobarbital and morphine are often prescribed. These drugs provide essential relief for severe pain or seizure disorders, helping people cope with their conditions. However, while they can be life-changing in certain situations, they come with serious risks, especially when it comes to mental clarity as we age. One of the most concerning side effects of these medications is their ability to cause sedation, confusion, and slower brain function. At first, they may seem effective, helping you relax or ease pain, but over time, they can cloud your mind, making it harder to think clearly, remember important details, or process information. For older adults, these effects can be even more pronounced, leading to a noticeable decline in cognitive function. The sedative effects of phenobarbital and morphine can make it difficult to stay alert or focused, and may even cause disorientation or confusion. This is especially concerning for seniors already dealing with aging or memory loss. The reality is these drugs can worsen an already challenging situation by impairing brain function over time. While they are often necessary for certain medical conditions, they should be used with caution, especially in older adults. If you or someone you love is taking phenobarbital or morphine, it's important to discuss potential alternatives or ways to minimize cognitive side effects with your doctor. There are often other pain management options that can help without jeopardizing mental health. Protecting your brain function should always be a priority, and it's crucial to work closely with your healthcare provider to ensure you are using the safest treatment options. After all, our minds are just as important as our bodies, and we deserve to care for both. Now, just because you're taking one of these medications doesn't mean you're automatically going to experience memory problems. Everyone's body reacts differently, and many factors come into play. But if you or someone you care about is using these medications regularly, it's always a good idea to have an open conversation with your healthcare provider. There may be safer alternatives or ways to reduce the risk of memory loss. It's all about making informed decisions and taking charge of your health, especially when it comes to something as crucial as your brain. Before we wrap up, I want to share 3 brain-boosting foods that should definitely be on your radar. These simple, everyday foods can support and protect your memory and overall brain health. First up, blueberries. These tiny fruits are loaded with antioxidants that protect brain cells from damage, making them a tasty and easy way to keep your brain sharp. Next, fatty fish like salmon, rich in omega-3 fatty acids. These essential fats help improve both memory and mood, keeping your mind clear and focused. And finally, turmeric, curcumin. This natural antiseptic isn't just for flavor, it may also improve memory and focus, so it's a great addition to your diet. Thanks for watching. Remember, your brain health is so important, and it's never too late to start taking care of it. Start making those small changes today. They can make a huge difference. If you found this video helpful, don't forget to hit that subscribe button and explore our other videos for more tips on staying healthy and sharp as you age. Your brain deserves the best care, and we're here to guide you every step of the way. Take care of yourself and take care of your brain.